Hi, welcome to this introduction to the Clinical Supervisor Toolkit course. I'm Dr. Susan Thompson, and this is a 1-hour presentation that gives you an introduction to the course as well as an introduction to supervision, clinical supervision especially. So I'm going to be sharing some PowerPoints and information with you over this next hour, just to give you an overview of what this course includes. So bear with me for 1 second here. There we go. As I said, this is an introduction to the Clinical Supervisor Toolkit course. Just a little bit about me. I've been an LPC since 1996. I've been an LPC clinical supervisor since 1998. And actually before that, I finished with my master's in 1986. I worked first in the university setting as a career counselor and then went back for my doctorate. So my doctorate is in counselor education and supervision. And I just fell in love with supervision during that time. If I fast forward a little bit, I spent 9 years as the Old Dominion University graduate counseling program clinical coordinator. And during that time, I also taught advanced and the introduction to counseling skills, as well as the introduction and advanced courses in supervision for master's and doctoral students. And as clinical coordinator, I oversaw all the supervision of the master's students as well as doc students in that program. My intention for this 1-hour presentation will be to define supervision and to talk a little bit about the essential aspects of clinical supervision, how it's different and the same eventually as other kinds of supervision. I'm going to really briefly, just by listing, introduce some theories and models of supervision. I'm going to talk a little bit about role induction in supervision and how that is important in this work. And an overview of this Supervisor Toolkit course. So the first question we should be asking is, what's supervision? And fortunately, it's been defined for us. It's a process in which an experienced person, a supervisor with appropriate training, which is what this course is about, and experience, which is why the LPC board requires 2 years of experience, mentors and teaches a subordinate or supervisee. It's a process of professional and personal development in which the supervisor challenges, stimulates, and encourages a counselor to reach higher levels of competence. I know that that doesn't always happen, and that's part of what I am interested in letting you know about, some things that I've learned over the course of the time that I've been providing supervision. So really, there are two distinctions of supervision. Two kinds of supervision. One is administrative, and the other is clinical supervision. So I think it's important to divide those into two really separate categories, because administrative supervisors don't always provide clinical supervision, and clinical supervisors don't always provide administrative supervision. There are supervisors, namely in some organizations, that provide both, but depending on the organization, you're probably going to end up being bent toward one or the other, but it's so hard to do both. So in the administrative supervisor time column, that's what takes place in organizations, bureaucratic organizations, nonprofit universities, schools. And in this kind of supervision, that supervisor helps the supervisee to function effectively as a part of the organization. And so their roles and tasks are going to be centered around the organizational accountability, referrals, performance evaluations, and that sort of thing. what distinguishes clinical supervision from administrative supervision is on competency. So clinical supervision is about focusing on the competent provision of a range of school counseling or professional counseling interventions, assessment, case management, cultural alertness of a supervisee's work with students or clients and stakeholders. They design and implement and evaluate comprehensive school counseling programs, as well as really take a look at what's happening on the clinical level and clinical skills for a supervisee. And it's about developing the supervisee's identity as a professional, as well as personal, if you remember from the definition a few minutes ago. So counselors more and more are facing job and challenges that are increasingly complex. Have you noticed? We have more and more ethical and legal challenges. And even though that reference is a while ago, that continues, that trend continues. Counseling skills, by the way, are likely to decline with time and without supervision. Most counselors end up continuing with their counseling, but don't seek supervision. And that, I think, is a difficulty in our profession. So I want you to think a few minutes about what your experience with supervision has been. What's your experience with being supervised? And if you're already a supervisor, some organizations I know have licensed folks provide supervision to unlicensed folks, and there are advanced unlicensed folks who provide supervision to our unlicensed residents as well. So I'm acknowledging that already exists, and just really think about what your experience with supervision has been. We'll be talking about that in our very first meeting this coming Saturday. And what about supervisor qualities that facilitate effective supervision? What have you noticed? Your own qualities, and also the qualities of the supervisee. What helps? And then how about supervisor qualities that inhibit effective supervision? And I'm not going to just limit it to supervisor qualities. I'm going to also open it up to how about supervisee qualities that inhibit effective supervision? So I'm guessing almost everybody has had experience with supervision that hasn't been exactly up to snuff. So really think about what happened and what it made it good supervision or effective supervision, and what made it really ineffective supervision. And in our first meeting all together, we'll have a discussion about this very thing. I wanted to also share with you some essentials of supervision. So we're laying the groundwork for the course in this 1-hour presentation. Some of the facilitative conditions that cut across models of supervision include a supervisor having empathy, genuineness, warmth, trust, positive regard, commitment to the supervisee, and monitoring the welfare of the client. We'll be talking later about what this actually looks like, how it plays out in supervision. And that's where you'll be sharing your experiences too. Some of the roles of clinical supervisor are so varied depending on the setting. So be thinking about what are the roles of a clinical supervisor. The Board of Counseling is very specific about what those roles are. And we'll be talking about what the expectations are of the Virginia Board of Counseling and how that plays out in the work that we do. So in terms of supervision, research recommends training supervisors, not assuming that counselors with experience will supervise well. So I'm very familiar that in most organizations, when somebody has been there either for a certain amount of time or has demonstrated some leadership qualities, they're put in supervisory positions. And They don't have training for that. We have all kinds of training as counselors to get to where we are, but very few organizations offer leadership training or supervisor training. And my intention is to, again, lay some groundwork for that for you. And then using supervision that's relevant. So in other words, there is a difference between leadership and clinical supervision. We'll be talking throughout the course about those two things. What does leadership look like? What does supervision look like? And the best supervision also has some kind of structured format versus informal supervision, which is more often likely to involve non-task issues, advice giving, and fewer constructive challenges. So when it's informal, it's not intentional, and it's important for it to be intentional and structured. And research also recommends an emphasis on enhancing multicultural competence. And that should be stressed even more these days. I know that in the last year or so, actually it's been longer than that, I'm so proud of our organization of counseling. Early on, ACA and counselor education programs sought to include a multicultural division, either division or coursework in a plan of study for counselors. Not all mental health related professions did that, but counseling did that early on. It was in the early 90s that happened. So we'll be talking about multiculturalism in supervision as well. And then another element that research recommends is continuous and consistent supervision. Not everybody is able to do that either. And ideally, it's facilitated by experienced counselors. We have our own identity, separate from psychologists and separate from social workers and psychiatrists. I love the idea of collaboration. However, counselors have separate training, and therefore, and the board made that change Board of Counseling made that change several years ago, that requires only LPCs to provide LPC supervision to residents in counseling. And so some other essentials to pay attention to in your supervision work with folks are the assumptions that you come to this work with, as well as your residents or other supervisees. Competencies, like where are they starting out? Talking about the supervisory relationship. We do that as counselors with our clients, so the same is true for supervision as well. That's called role induction, and I'll be talking about that here in a little bit. Professionalism, some kind of assessment and feedback. How do you address problems? How do you address ethical and legal issues as well in supervision? And our course will be covering those essentials as well. We'll also be reviewing the ACA codes of ethics, as well as the approved clinical supervisor code of ethics and the Association of Counselor Educators and Supervisors, that's ACEs, codes of ethics. So there are codes of ethics that cut across these different organizations that we'll be taking a look at, as well as how psychologists' code of ethics for supervisors are a little bit different and the same. We'll be talking too about theories and models of clinical supervision throughout the course, especially in the first session, also a little bit in the second session that we have. And I'm going to give a little bit of an overview here as we get started. There are as many different theories of supervision as there are theories of counseling. Actually, I kind of take that back, because I'm not sure that newer theories of counseling have a theory of supervision, but there is an overlay. And we'll be talking about psychodynamic theories of supervision, person-centered or Rogerian, behavioral supervision, developmental supervision, cognitive, systemic, integrative models of supervision, that's my favorite, and solution-focused supervision. There are other specialized models of supervision, including group supervision, school counselor, career counselor, and family related models of supervision. I do want to give you a quick overview of one model of supervision because to me it makes the most sense. It's a three-stage model, a three-phase model of supervision that comes from Holloway. It's an older model, but older models are good models too. It's three phases, as I said. One is developing. This one is about developing. And it's really getting started. So in this model of supervision, the supervisee is in a phase of developing skills. And the second phase, it's mature phase. I'll be talking about that in a few minutes. And then terminating. How simple is that? Three-phase model. It's similar to a three-phase model of group development too, a beginning, middle, and end phase. I'll talk a little bit about some models of group as well. So this developing phase is about clarifying the relationship with the supervisor, establishing a supervision contract, supporting any kind of teaching interventions because clinical supervision is about teaching too. Developing competencies, how do you go about doing that? And I'll be borrowing from my experience as a faculty member and clinical coordinator to help you with that. And developing intervention plans. We're clear about that with clients. The same kind of strategies can be helpful in supervision as well. And then this is one of the most difficult things. How do you address possible supervisee difficulties? From resistance to avoidance to conflict and self-concept. That part is one of the most challenging for supervisors. The mature phase, which is the second phase, is an increase in individual nature of the relationship. It's becoming less role-bound. It's a little bit more flexible, adaptable, and integrative in this case. There's an increase in social bonding and influence potential from the role of the supervisor. There's a development in terms of case conceptualization skills for the supervisee, potentially more an increase in self-competency and self-efficacy in counseling. We hope that people are moving toward that anyway. And also being able to confront personal issues with the supervisee as they relate to your professional performance, especially. And then the terminating phase would be helping your supervisee understand connections between theory and practice in relationship to particular clients, decreasing the need for direction from the supervisor. There's a model that I'll be talking about in our course that I really appreciate, and that model actually will talk about how to look at that development of your supervisee. In our first meeting, we'll also be talking about problems for beginning counselors. That has been looked at from the research perspective, and we'll be looking at the transition that beginning counselors make from being a student to being a professional. And some of them do it well, and others aren't doing it so well. And we'll be talking about how to deal with these common problems. First, we make sure that we're the ones who are ready, and this course is intended to help you with that. I've got a checklist that will be helpful as well. And we find ways to educate and inform supervisees about the supervision process. That, again, is called role induction. So, brings me right to it. What is role induction? With clients, we call it informed consent. With supervision, it's called role induction. And the purpose of it is to clarify the purpose and format of supervision. Its intention is to prepare supervisees for the process of supervision by explaining the roles and expectations and nature of supervision to reduce the confusion and anxiety of the supervisee. A lot of times supervisees come to supervision with anxiety and certainly preconceived notions of what supervision is, just like we do. So role induction does work, just like informed consent works. It helps by really clarifying the process and the roles in supervision, the supervisee process and roles, and also the supervisor process and roles, so that supervisees are less confused about what supervision entails. They're more clear about conceptualizing student or client and stakeholder concerns. They're able to see supervision providing structure and better able to express needs and concerns to their supervisor when they're clear about those roles and processes. Role induction also outlines the primary roles of the supervisor as a teacher, as a counselor, and as a consultant. Those are three major roles, and we'll be talking about that in our course as well. This role induction allows supervisees to better understand the purposes of supervision, and we'll be talking about the discrimination model during our course too. The first supervision session should cover a number of things. That's part of role induction, just like the first session in counseling covers a number of issues and topics. And one for supervision is to explain the purpose of supervision. And that's the purpose of this 1 hour. It's to explain the confidentiality and limits of confidentiality. And by the way, we're not covered as supervisors the same way that counselors are covered, as well as previous supervision experience, both the supervisee's experience as well as our experience as supervisors. Communication style. In other words, you might start asking about feedback and how supervisees like to receive feedback. We'll be talking about some ways to do that that are more effective, comparing to the feedback sandwich, and how to let supervisors know that they're off base. Learning preferences. So there might be some ways that you talk about learning preferences from the supervisee's perspective. You'll talk about supervisee strengths and supervisor strengths, as well as the roles of both of you. Maybe even supervisee theoretical perspectives, what they are, where they want to be, where the supervisee is in their development. There's that multicultural component that I talked about before. We'll talk about goals for supervision and other issues like meeting times and schedule. So those details that will be important to set the stage for the work, including gatekeeping. So gatekeeping is a part of what we do as supervisors. How we give feedback makes a difference. Who to call and when to call are also issues to be talking about. How to carve out that hour for supervision or more. And then I've got a couple of templates for case studies in supervision that you're welcome to use as well. So we'll be covering quite a bit in this 20-hour CE supervision course. I really appreciate that you're going to be joining me. The essence of our time together in this segment has been about our responsibilities and some of the theories of supervision. That our responsibilities include teacher, counselor, in quotes, and we'll talk about that in the course as well. Consultant and mentor and coach. We evaluate supervisees' skills. We make sure that their work is ethical, and how we address that can be helpful and important. As gatekeepers, We are the ones that determine if a supervisee is competent to enter the profession. We fill out quarterly evaluations that let the board know, and our supervisee, that they're competent to continue. And we monitor care. We monitor client care as well as that supervisee. The supervisee operates under our license to begin with. And we are ultimately responsible for their interventions with clients and stakeholders as well. So what we'll be talking about here in the next few minutes is what we're going to be talking about during our time together in this Clinical Supervisor Toolkit course. So, ready for the outline?